To find out if you qualify for a complimentary consultation, call our office today at 407-977-3842. This visit is normally $245, but will be provided at no charge to those who qualify today. This offer is only for those who have been previously diagnosed with type 2 diabetes and are currently taking medication. Call now or visit myiho.com.
If you are just joining us, we are here with Dr. Marc Ott and Dr. Heather Carter from Integrative Health of Orlando, talking about how they are changing the lives of those diagnosed with type 2 diabetes right here in the Orlando area. Now, unfortunately, not everyone qualifies as a patient. What are some of the criteria you look for when selecting a patient that is appropriate for this type of treatment?
That's a great question, because we do have a qualification process in order. But I'll tell you, it does not matter if you're male or female, if you're on insulin or not. It doesn't even matter if you were diagnosed yesterday or 25 years ago. You know, none of those things so much matter to us. The thing that is most important is if you're motivated and committed. If you're committed to your health, to getting well, to yourself, to turning this disease around and becoming a non-diabetic, those are the things that are most important, because we know those are the patients who they're going to get the best results. So that's really what we're looking for.
And how can you tell if someone's truly committed?
Well, we ask the questions. It's not just you called us and therefore you get to be a patient in the practice. There's a process we go through with our patients of making sure that they're really prepared to make the changes and choices that will need to be made. I tell patients all the time, becoming non-diabetic can be done in a fairly short period of time for many, many patients. That doesn't mean, however, that it's easy to do. It requires a significant level of commitment on their part. They're going to have to be willing to engage in their care in a way that they've probably never done before. Most patients are kind of used to looking to the doctor to do all the healing, right? And the reality is that's not what doctors do. I mean, our job is to find the problems, facilitate the solutions, but the patient's going to have to take an active role. They're going to have to be part of solving that problem. So they're going to have to be willing to make some lifestyle choices. They're going to have to be willing to make dietary changes for sure. There's no way that it's going to happen without that. And as we said earlier, diet doesn't fix the problem all by itself, but it's a crucial component to providing some stability while we try and do that work that needs to be done.
And I would imagine that family support is really important in that particular area.
Yeah, it certainly is. You need the support of the people who are closest with you. If you have someone who you're with on a daily basis, you eat your meals with them, you're making life decisions with them, you're going to need their support to keep you through this. We've done it before where that person that they had wasn't on board with them, wasn't very supportive, and we ended up just having a saboteur at home. We'd have these setbacks because they didn't have that person helping them keep their focus and getting well.
It's hard enough to change bad habits, but if you don't have that support system as well, it's really going to be difficult.
Absolutely. I mean, there's not a diabetic in the world who needs a heckler at home, I mean, while they're trying to do the work that's necessary to get well, the last thing they need is their loved ones, constantly being, in their ear, telling them that they can't do it and what they're doing isn't going to work and all that kind of stuff. I mean, they really need to have someone who's in their corner. In fact, it's a requirement for us. I mean, if there's a significant other in their life like that, we want to know that person can support them, that they're willing to not necessarily engage and be part of their treatment, but at least understands what the patient's going through, understands what's at stake and what they have to do to really get well, and they're willing to get behind that. And help facilitate that and not be someone, like Dr. Carter said, who sabotages the process for them.
Well, I can imagine that maybe even at home, if there are some bad habits going on, that maybe another family member could be suffering from the same problem, not even know it.
Yeah, we do see that sometimes, but like Dr. Ott said, it does require the patient's effort, so they do need that, to go through it with them together. Because our knowledge of the disease is not enough by itself. We need the patient to work with us through the entire process to become the non-diabetic that, that's our result in the end.
Oh, absolutely. I know that many people are already calling right now, but when we come back, the doctors will discuss how many of you watching will be able to find new hope for your diabetes. Don't go away.